Today we're talking about very important vitamins for people with type 2 diabetes. If you or someone you know is dealing with this condition, you'll want to stick around. We're going to explore which vitamins are crucial and why they matter. Let's start with the basics. When you have type 2 diabetes, your body struggles to use insulin properly. This can mess with how you process nutrients, including vitamins. But don't worry, we're here to help you understand which vitamins are especially important. First up, let's talk about vitamin D. This sunshine vitamin is a superstar when it comes to diabetes management. Research shows that many people with type 2 diabetes have low vitamin D levels. Why does this matter? Well, vitamin D works to improve how your body responds to insulin. It's like a little helper, making sure insulin does its job better. Some studies even suggest that getting enough vitamin D might stop you from developing type 2 diabetes and stop progressing from prediabetes to full-blown type 2 diabetes in the first place. But here's the catch, it's not always easy to get enough vitamin D from sunlight or food alone. That's why some doctors recommend vitamin D supplements for people with diabetes. Of course, you'll want to chat with your healthcare provider before starting any new supplements. Now, let's move on to the B vitamins. These are like the energy boosters of the vitamin world. For people with diabetes, B vitamins are super important. They work to help your body turn food into energy and keep your nerves healthy. One B vitamin that deserves special attention is B12. Here's why. A common diabetes medication called metformin can lower B12 levels in your body over time. So if you're taking metformin, you might need extra B12. Low B12 can lead to nerve problems, which is something people with diabetes already need to watch out for. Another B vitamin to keep an eye on is thiamine, also known as B1. Some research suggests that people with type 2 diabetes might have lower levels of thiamine. This vitamin works to help your body process carbs, which is pretty important when you're managing blood sugar. If you have symptoms like muscle weakness, cramps, muscle twitching, loss of muscle and bone, numbness or tingling, loss of sensation or feeling in body parts, loss of balance or other functions as a side effect of the loss of feeling in the legs, arms, or other body parts, it could be peripheral neuropathy symptoms. Talk to your healthcare provider to get proper assessment, and maybe taking vitamin B1 supplements may help. Better version of vitamin B1 like benfotiamine may be beneficial. But wait, there's more. Let's talk about vitamin C. You might think of vitamin C as just a cold fighter, but it's got a lot more going on. For people with diabetes, vitamin C can be a powerful ally. It works as an antioxidant, which means it helps protect your cells from damage. Some studies have found that people with diabetes tend to have lower levels of vitamin C in their blood. This is a problem because vitamin C works to help your body use insulin more effectively. It might also help lower blood sugar levels and reduce inflammation. Vitamin C plays a crucial role in wound healing, and we now know that half of the patients with DFUs are deficient in vitamin C. There's also a strong association between low vitamin C levels and high levels of amputation. Now, you might be thinking, great, I'll just take a bunch of vitamin C supplements. But hold on a second. While getting enough vitamin C is important, more isn't always better. Too much can actually interfere with some diabetes tests. So it's best to focus on getting your vitamin C from fruits and veggies, and talk to your doctor about whether you need supplements. Let's switch gears and talk about vitamin E. This is another antioxidant that's important for everyone, but especially for people with diabetes. Vitamin E works to protect your cells from damage caused by high blood sugar. Some research suggests it might even help improve insulin sensitivity. But here's the thing, most studies on vitamin E and diabetes have been done on animals or in labs. We still need more research to fully understand how it works in people with diabetes. So while it's good to include vitamin E-rich foods in your diet, like nuts and seeds, you should be cautious about taking high-dose supplements without talking to your doctor first. Now, let's chat about a vitamin that doesn't get as much attention, vitamin K. This vitamin works to help your blood clot properly, but it might also play a role in blood sugar control. Some studies have found that people with higher vitamin K intake have better insulin sensitivity. Vitamin K2, which is a much more powerful version of vitamin K, activates a protein that helps the mineral bind to our bones to do its job. Our bodies need calcium to build and maintain bones. Research shows a higher K2 intake improves bone density and reduces the risk of bone fractures. It is better to combine vitamin K2, vitamin D, and calcium together to have the maximum effect. If you're taking blood thinners, you need to be careful about changing your vitamin K intake. Discuss that with your doctor. Vitamin A has emerged as a potentially significant factor in the management and understanding of diabetes. Recent research has highlighted several advantages of vitamin A for diabetes, particularly regarding its role in insulin production and beta cell function. Let's delve into these benefits in simple terms. Vitamin A improves insulin production. But before you run for the supplements, it is important to note that too much vitamin A can be harmful. So best source is to take beta-carotene-rich foods like carrots, pumpkin and leafy greens. One of the most exciting findings is that vitamin A appears to enhance the function of insulin-producing beta cells in the pancreas. Beta cells are crucial because they produce insulin, the hormone that helps regulate blood sugar levels. Researchers discovered that vitamin A receptors are present on the surface of these beta cells. When these receptors are activated by vitamin A, insulin secretion improves, which is vital for managing blood sugar levels effectively. Vitamin A also plays a protective role for beta cells. In conditions where there is inflammation, which is common in diabetes, vitamin A helps beta cells resist damage and death. This is particularly important for both type 1 and type 2 diabetes. In type 1 diabetes, the immune system attacks and destroys beta cells, while in type 2 diabetes, beta cells can become dysfunctional and die due to prolonged high blood sugar levels and inflammation. Ensuring adequate vitamin A levels can help maintain the health and function of these cells. How to prevent vitamin A deficiency? Vitamin A deficiency has been linked to the development and progression of diabetes. Studies on mice have shown that a lack of vitamin A can lead to the death of beta cells and a subsequent rise in blood sugar levels. When vitamin A was reintroduced into their diet, the number of beta cells stabilized, insulin production increased, and blood sugar levels returned to normal. This suggests that maintaining adequate vitamin A levels is crucial for preventing beta cell loss and managing diabetes effectively. Inflammation is a common issue in diabetes, contributing to insulin resistance and beta cell dysfunction. Vitamin A has anti-inflammatory properties that can help reduce inflammation in the body, thereby protecting beta cells and improving insulin sensitivity. This makes vitamin A a valuable nutrient in managing the inflammatory aspects of diabetes. Vitamin A is abundant in foods like liver, dairy products, and certain vegetables like carrots and pumpkins. However, it's important to balance vitamin A intake from supplements. While deficiency can be harmful, excessive vitamin A can also cause health issues such as osteoporosis. Therefore, it's crucial to aim for a balanced diet that provides adequate but not excessive amounts of vitamin A to avoid vitamin A from supplements and fortified products. There is no evidence to suggest beta-carotene is harmful. Potential for new treatments for diabetes by supplementing vitamin A. Given its significant role in beta cell function and insulin production, researchers are exploring the possibility of developing new diabetes treatments based on vitamin A or its analogues. These treatments could potentially enhance beta cell function and insulin secretion without the risks associated with high vitamin A intake. This area of research is still in its early stages, but it holds promise for future diabetes therapies. In summary, vitamin A offers several advantages for diabetes management, primarily through its positive effects on insulin-producing beta cells and its anti-inflammatory properties. Ensuring adequate vitamin A intake through a balanced diet can help protect beta cells, improve insulin production, and manage inflammation, all of which are crucial for effective diabetes management. However, it's important to avoid excessive intake and consult with healthcare providers to determine the best approach for incorporating vitamin A into your diabetes management plan. Magnesium is one of the most important minerals for people with diabetes. It works to improve insulin sensitivity and glucose metabolism. Many people with diabetes, especially those with poorly controlled blood sugar, tend to have low magnesium levels. This can lead to increased insulin resistance and worsen blood sugar control. Magnesium also helps regulate blood pressure and supports heart health, which is particularly important for people with diabetes who are at higher risk for cardiovascular issues. Chromium is another mineral that's gained attention in diabetes management. It works to enhance the action of insulin and may help improve glucose tolerance. Some studies have shown that chromium supplementation can improve glycemic control in people with diabetes, though results have been mixed. While more research is needed, ensuring adequate chromium intake through diet or supplementation may be beneficial for some individuals with diabetes. Zinc plays a role in insulin production and storage in the body. People with uncontrolled diabetes often have increased zinc losses through urine. Zinc deficiency can affect wound healing, which is particularly important for diabetics who may be prone to slow healing wounds. Some studies have suggested that zinc supplementation might help with skin ulceration healing in older adults with diabetes. Calcium is important for bone health, which can be compromised in people with diabetes due to various factors including medication side effects and metabolic changes. Ensuring adequate calcium intake, along with vitamin D, is crucial for preventing osteoporosis and maintaining overall bone health in diabetics. Potassium is essential for proper nerve function and muscle control. It also works to help regulate blood pressure, which is often a concern for people with diabetes. Maintaining adequate potassium levels is important, especially for those on diuretic medications which can deplete potassium. Selenium has antioxidant properties and may play a role in protecting cells from damage caused by high blood sugar levels. Some observational studies have found an inverse association between selenium levels and the risk of gestational diabetes, though more research is needed in this area. Vanadium is a trace mineral that has shown some promise in improving insulin sensitivity in animal studies, but human research is limited and inconclusive. It's important to note that while these minerals are crucial for health, more isn't always better. Excessive intake of certain minerals can be harmful. For example, too much zinc can interfere with copper absorption, and excessive chromium intake may cause stomach irritation or kidney damage. The best approach is to focus on getting these minerals through a balanced, nutrient-rich diet that includes a variety of fruits, vegetables, whole grains, lean proteins, and healthy fats. For people with diabetes who may have difficulty meeting their mineral needs through diet alone, or who have confirmed deficiencies, supplementation under the guidance of a healthcare provider may be beneficial. Okay, let's take a breather and recap before we dive into the need for minerals. We've talked about vitamins D, B, especially B12 and thiamine, C, E, and K. All of these can be important for people with type 2 diabetes. But here's the million-dollar question: should you take a multivitamin? My answer is yes, but try to get mostly from foods, and if you still find deficiencies, take supplements under the guidance of a medical professional.